Today, we're discussing the myths surrounding vitiligo. As always, this is information only. Please do not use this as medical advice and enjoy. Today, we're really going to focus on vitiligo and the myths surrounding it. Vitiligo affects millions of people. I've created a video previously regarding the epidemiology and basic understanding of vitiligo. Unfortunately, there are a lot of myths surrounding vitiligo, and I hope to debunk many of those myths now. So, let's start with a prompt. Imagine waking up to find your skin is losing color, transforming your appearance. This is something that happens to millions of people and is very common in those experiencing vitiligo. However, there are widespread misconceptions and social stigma surrounding this condition, and so I'd like to approach those now. So, common vitiligo myths. Vitiligo is mistakenly believed to be contagious. People mistakenly believe that vitiligo is caused by something they ate or triggers, such as the sunlight. There's misconceptions that vitiligo is related to other conditions that lighten your skin, such as albinism or leprosy. Some people believe vitiligo is just a cosmetic concern. Some people believe that vitiligo only occurs if you have dark skin at baseline. And others believe that vitiligo will often just resolve on its own without any necessary treatment. Remember, vitiligo is an autoimmune disorder where the body's attacking its own melanocytes, the cells that produce that pigment. This process leads to those characteristic white patches on the skin. So let's debunk the first three myths. Vitiligo is not contagious. It cannot be transmitted from person to person. There is no strong dietary link to vitiligo. There are some case reports here and there. For example, if a patient is found to be gluten intolerant, they start developing vitiligo, they take gluten out of their life, and their vitiligo improves. Those are far and few in between and not the norm. And in unrelated conditions, vitiligo is not related to leprosy, it's not related to skin cancer or albinism. Skin tones. Vitiligo can affect all skin tones, all types, white, black, brown, Middle Eastern, Hispanic, doesn't matter. Vitiligo is not related to sun damage. Although people might think that the sun exposure can trigger vitiligo, which is seen, it's not the cause of the vitiligo, and it's not the reason that one has vitiligo. And finally, yes, there is currently no cure for vitiligo, but various treatments can help manage the condition and improve skin appearance. We dive into this in another video, but there are topical treatments, there are oral treatments, and there's light therapy. I imagine in the next 10, likely even in just the next 5 years, there will be improved oral, IV, and injectable treatments for vitiligo. So, triggers of vitiligo that we should acknowledge. Stress is a huge component for vitiligo, as it is for many skin conditions. Injury, something called the Kebner phenomenon. This is found in vitiligo as well as other conditions such as psoriasis, where trauma, like a sunburn, a cut, a bite, can lead to vitiligo or a rash in that area. Hereditary, vitiligo can run in families, which suggests a genetic component, although it does not necessarily mean you're going to get vitiligo if a family member has it. Hormonal changes. We see vitiligo during certain peaks in life, and this may be related to hormonal fluctuations. For example, in childhood, puberty, pregnancy, etc. There are certain chemicals that have been known to cause bleaching of the skin, such as benzenes, but chemical exposures to adhesives, deodorants, other products, although they may trigger vitiligo, I would argue that that is rather rare and pretty hard to prove. So let's quickly talk about the social impact of vitiligo. I'm going to dive into this in another presentation where we can look at independent literature. But vitiligo leads to social stigma. People with vitiligo can face prejudice, exclusion, stereotypes due to these misconceptions about their condition, particularly children. Cultural beliefs. For example, in India, where vitiligo is very prevalent, cultural beliefs are often associated with a curse or punishment, leading to significant social stigma. And then personal challenges. Individuals with vitiligo can face difficulties in areas like relationships and marriages and social acceptance due to these myths. All this being said, it is clear that vitiligo can have a significant impact on our emotional health. These myths only worsen that emotional well-being because it leads to feelings of shame, embarrassment, and low self-esteem, leading to anxiety and depression. And there are many studies to show increased anxiety, increased depression in those with skin conditions such as vitiligo. By debunking vitiligo myths, we can promote understanding, acceptance, and support for people with this condition. We can challenge these myths. We can provide accurate information. We can create a more inclusive and supportive environment and help those with vitiligo. If you found this helpful, if you found this informative, please share this. Please like it. It helps me reach out to others who might find this beneficial. And as always, if you have any questions, concerns, please do not hesitate to reach out.